Hi, and welcome to day 2 of Mental Health America's 2020 annual conference. For those of you who are just joining us today, my name is Tom Starling. I'm the former board chair of Mental Health America and currently the CEO and president of MHA of the Mid-South here in Nashville. We are thrilled to have you all here with us today on day 2 of MHA's 2020 annual conference, COVID-19, mental health, and the need for equity. Our program today is really jam-packed with some incredible speakers who will be talking about what young people are doing to build resiliency in uncertain times, what teachers and parents are grappling with as many children are going back to school, how telemental health has been a critical option for therapy during this time, and finally, how racism and trauma have shaped the lives of so many Americans, and what we can all do today to help change that. But before I introduce our first panel, I'd like to take this opportunity to highlight a couple of MHA's 2020 award winners and hear from them directly on what it means for them to be honored. First, MHA's 2020 Mental Health Corporate Excellence Award. MHA bestows this award to an exemplary corporation that promotes the mental health of its employees, stakeholders, and the community. MHA looks at several criteria, including a company's commitment to its employees by offering programs, accommodations, and training that supports mental health and wellness in the workplace, a commitment to its community through contributions, education, job training, housing programs, public awareness campaigns, or other related activities. Has the company created and implemented policies and practices that destigmatize mental health concerns and ends discrimination against people with mental illnesses? And finally, can the company's mental health policies and practices be easily replicable in other corporate settings? This year's 2020 Mental Health Corporate Excellence Award goes to Verizon Media. Verizon Media is committed to shaping the way mental health is perceived and supported within its workforce and the global community it serves. The media company reaches more than 900 million people across the globe each month, connecting them with trusted news and content from its ecosystem of premium brands like Yahoo, TechCrunch, and HuffPost. With a focus on breaking down stigmas and normalizing mental health, Verizon Media implemented a comprehensive plan to address the emotional well-being of its workforce. Through partnerships with leading mental health organizations, they established best practices and implemented training programs centered on building a robust wellness program. And in the wake of COVID-19, the company expanded existing resources and developed new offerings to address unprecedented health crises. Let's look now at a brief video that Verizon Media has created this past Mental Health Month for its employees, just as an example of its commitment to their overall mental well-being.
The way I would define mental health is just kind of the clarity that you have in your mind.
Mental health is not dissimilar from physical health in that it is a product of your environment.
Psychological, emotional, social relationship. So to me, it's multifacets.
I didn't know it at the time, but I started to experience mental health issues probably in elementary school.
My younger sister, she suffers from anxiety disorder and OCD, and she just like completely lost control and she harmed herself physically.
I really didn't quite know about depression, but I knew my mother went through depression a couple of years when I was much younger.
I've had friends and family who've had issues with mental health, and some of them who've been open about it and taken care of themselves, and some of them, they've not ended well.
It took me a very long time and I definitely sunk very far before I got to the point where I could seek help.
The biggest cultural stigma for a lot of people who don't share or they don't want to talk about this, society looks down.
People don't like to talk about that or really avoid even dealing with this issue head on.
那很多人不愿意承认自己有心理的问题，觉得这是一个很丢脸的事情。
I think the only thing we as humans that we can do here is to let this be open, let this be easy for people who are suffering with mental health to be able to open about and talk about it.
I think that once the discussion opens up, it won't seem as like foreign or strange to have mental health or seek help.
那当你有心理健康的时候，你不妨可以跟我们讨论。
Mental health sometimes is not something you can control, but having that awareness is so important. When you are on the verge of something that you feel you are not at the best of yourself, how do you stop and reflect what is really going on with you, and not to be afraid to share that with your close friends, family.
It's our responsibility to be able to make that stigma go away, for people to be able to talk about transparently so that we can do something about it.
We're all here for each other.
Accepting MHA's 2020 Mental Health Corporate Excellence Award on behalf of Verizon Media is its CEO, Guru Gowrappan.
Hi, I'm Guru Gowrappan, CEO of Verizon Media. I'm very humbled to accept this award on behalf of Verizon Media and in recognition of the work we've done to reduce the stigma of mental health and race awareness. Mental health has been personally important for me and a priority for Verizon Media well before the pandemic. I grew up in Asia where there was a lot more stigma around mental health. Unfortunately, the stigma still persists even today. Since I became CEO of Verizon Media in 2018, we began having important conversations to create more empathy, awareness, and understanding of mental health. We expanded our employee mental health programs and focused our efforts on the editorial content we were creating for the nearly 900 million people who turned to us for trusted content, like information, resources, support, and utilities. I know the focus of this conference is really on the relationship between COVID-19 and mental health, but the reality is that we were able to quickly step up for our employees during COVID because of the groundwork we had already established. And that is the key to any mental health initiative, program, or a plan. Consistency. We need to consistently speak about it, share our stories, listen to others, and provide support every day. And not just in times of crisis or when it is trending on social media. I'm very proud of the work we have done at Verizon Media to receive this recognition. To me, this award also represents a commitment, a contract really, about the future work we have yet to do. We owe our best efforts to this cause to all of our four stakeholders, our employees, our customers, our society, and our shareholders. And when we can all be our best, most supported selves, we all win. And I can't honestly do my job to the best of my ability without making mental health a priority. So thank you, Mental Health America, for the recognition, to our team at Verizon Media, who are great change makers and advocates for mental health.
Thanks so much, Guru, and congratulations to you and your team. And now, the George Goodman and Ruth P. Brudney Social Work Award. This award was established by the Board of Directors of MHA in November of 1986 to recognize a significant contribution made to the care and treatment of people with mental illnesses by practicing professionals in the field of social work. The award's establishment was actually made possible through a gift by George Brudney, a member of the MHA Board of Directors, in memory of his wife, Ruth, a psychiatric social worker. Nominees for this award must have shown that he or she has demonstrated a passion and dedication to the profession of social work and improving the care and treatment of people who have mental illnesses, and that they serve as an inspiration for their clients, patients, colleagues, and those pursuing the field of social work. This year's award goes to Julius Boatwright. Julius is a licensed master social worker who completed a trauma-informed community practice workshop with Duquesne University through their Department of Psychology and the Rita McGinley Clinic. He obtained his Master of Social Work degree with a certificate in Human Services Management from the University of Pittsburgh. Julius also earned a bachelor's degree in communication from Pitt. Mr. Boatwright completed a one-year professional development program for nonprofit executives with Leadership Pittsburgh and the California-based Rockwood Leadership Institute. Julius serves as the founder and chief executive officer with Still Smiling, an organization that bridges the gap between Black people and mental health supports through education, advocacy, and awareness. Their mental health workforce development programs, called Beams to Bridges, equips Black adults with knowledge, skills, and competencies needed to serve as community mental health workers. While completing the programmatic experience, these cohort members receive the weekly workforce stipends, emergency financial assistance, mental health training, behavioral health treatment, and social services support. Wow. Welcome Julius Boatwright, MHA's 2020 recipient of the George Goodman and Ruth P. Brudney Social Work Award.
Hello everyone, my name is Julius Boatwright and I have the privilege and honor of serving as the founder and chief executive officer with Still Smiling. Our mission is to bridge the gap between Black people and mental health support through three ways: education, advocacy, and awareness. Our 10-year vision is to connect every Black person in Allegheny County to at least one positive mental health experience that improves their quality of life by the year 2030. Our Black Mental Health Workforce Development Program, otherwise known as Beams to Bridges, equips children, youth, and adults with the skills and competencies they need to serve as trusted community mental health champions. While going through this program experience, they receive weekly workforce development stipends, emergency financial assistance, and access to funds that help offset costs related to mental health treatment. Now, in the midst of multiple crises, racial, economic, and public health, it is imperative that we pay very close attention to the mental health and wellness needs of Black people. So I am honored, grateful, and appreciative that Mental Health America is giving us an opportunity to convene and talk about this very critical and important subject matter at this moment in time. I always end by saying, somebody loves you, somebody values you, and somebody appreciates you. Please do whatever you need to tend to your own mental health needs and to provide some support and encouragement to every single person that you encounter. Please take care and enjoy the rest of the conference. Thank you.
Now, moving on in our agenda. In conjunction with Born This Way Foundation, our next panel is made up of youth advocates who will share with us perspectives on the best way to bridge the gap between available mental health resources and the young people who so desperately need them. Moderated by Kelly Davis, MHA's Director of Peer Advocacy, Support, and Services, we will hear from three incredible individuals who are working to improve health equity, break down stigmas associated with mental illnesses, and address systemic injustices around the nation. Kelly, take it away.